Oh yeah, should you share the screen? Oh, thank you. All right, so good morning, everyone. Thanks for attending today. In this session, we'll be talking about various topics in neurology and neurosurgery, such as neurosurgical procedures and neurological disorders. We'll also be talking about some commonly used equipment, surgical tools, and scans in these medical fields. But before we do that, we're going to start off with a fun icebreaker. All right, so the question is, what diseases come to mind when you hear the terms neurology and neurosurgery? So you guys can go to www.menti.com and then use the code 36460507.
Yeah, and you guys can feel free to put it in the chat also, if you can't make it to the link. And then to submit answers, you can use this link also.
I see some interesting responses in the chat. Brain tumors, yeah, that's definitely a part of it. The brain. Alzheimer's, we'll be talking about that in this presentation. So you're kind of hinting on that, on what we're going to be talking about today. Anyone else have anything? Any diseases coming to mind when they think of neurology and neurosurgery?
Okay, the Menti is kind of frozen, but there's Alzheimer's, Parkinson's, brain studies, strokes. I think those are things that we will also talk about today, so that's good. Okay, maybe we'll project this a little bit later after it loads, but yeah, we can go on with the slides.
All right, so yeah, I'm just going to do a brief introduction of what neurology and neurosurgery are. So we'll first start with defining what neurology and neurosurgery are separately. So neurology deals with the anatomy, functions, and the organic disorders of the nerves and nervous system. Neurosurgery, on the other hand, deals with surgery on the nervous system. Both neurologists and neurosurgeons specialize in the same body system and can diagnose and treat conditions, but neurosurgeons can perform medical procedures on the brain, whereas neurologists can't. Your nervous system is made up of your brain and spinal cord, which make up your central nervous system, and your nerves, which make up your peripheral nervous system. We'll now introduce some common disorders that neurologists and neurosurgeons diagnose and treat.
We will start off by talking about headaches. A headache is a painful sensation that may occur in any part of the head, usually accompanied with other symptoms. The four most common types of headaches include sinus, tension, migraine, and cluster. Some causes of headaches include any changes in eating or sleeping patterns, stress of any kind, lighting that might be too bright, noise, changes in weather, and illness, as people often develop headaches when they have colds. Symptoms of headaches include pain in the head and or around the eyes, being sensitive to any light or noise, fatigue, having trouble concentrating, and general muscle pain. The treatment for headaches varies depending on the severity, but generally over-the-counter remedies such as aspirin and ibuprofen, as well as resting and hydrating, are used to help with headaches. Lastly, here is a fun fact for you. Headaches are actually the result of signals interacting among the brain, blood vessels, and surrounding nerves. In a headache, an unknown mechanism activates specific nerves that affect the blood vessels and muscles, which sends pain signals to the brain. This is why people feel pain during a headache. That is all for headaches. We will now talk about epilepsy and seizures. We will now be discussing epilepsy and seizures. You may be wondering, what does epilepsy mean? Well, epilepsy is a condition in which seizures are caused when nerve cell activity in the brain is disturbed. While there are many causes, some general ones include genetic disorders, brain trauma, prenatal injury, malnutrition, and brain conditions, such as brain tumors or abnormal blood vessels in the brain. Symptoms of epilepsy and seizures include temporary confusion, uncontrollable jerking movements of the arms and legs, loss of consciousness, an intense feeling of either fear or joy, stiffness or twitching in a part of the body, sudden falls, and staring into space. Treatment for epilepsy and seizures depend on the cause and severity of the disorder, but usually include medications, surgery, and dietary changes. Here is a fun fact. There are two main types of epilepsy and seizures, which are general and focal. General epilepsy involves the loss of consciousness and violent muscle contractions, while focal epilepsy causes a person to stare blankly into space and experience automatisms, which are non-purposeful, repetitive movements. That is all for epilepsy and seizures. I hope you learned something new. We will now move on to strokes.
Hello, so now we are going to be talking about strokes. So a stroke is when the blood supply to your brain is low or limited. Well, how does this happen? Well, sometimes a clot is blocking the blood from flowing through the arteries, and this is called an ischemic stroke. And other times a blood vessel ruptures in the artery, which is called a hemorrhagic stroke. When either of these happen, brain cells cannot get enough nutrients that they usually would from these blood cells, so the brain cells start to die as quickly as within minutes. So what are some symptoms? So when it comes to a stroke, it's all very sudden. So it can be sudden numbness or weakness, sudden confusion, such as trouble seeing or trouble walking. It can also be something like sudden paralysis. So for stroke, there are a variety of treatments, including treatments with blood thinners or different medications. And then there's a surgery called carotid endarterectomy. But the main treatments that people use these days are emergency IV medication, in which they inject something into your arteries. And again, it's all very sudden, so it's just kind of based on the person and the situation, and the doctors will be deciding on the spot. Stroke is one of the top 5 leading causes of death because, again, you never know what's happening. So people's lives can be lost really quickly because there's no time to do anything. So hopefully we'll be making more advancements to better treat these people in the future. And now I will be passing it on to Kathleen.
Amyotrophic lateral sclerosis, or ALS, is a progressive nervous system disease that affects nerve cells in the brain and spinal cord, causing loss of muscle control. ALS often begins with muscle twitching and weakness in a limb or slurred speech. Eventually, ALS affects control of the muscles needed to move, speak, eat, and breathe. There is no cure for this fatal disease. Signs and symptoms of ALS vary greatly from person to person, depending on which neurons are affected. ALS often starts in the hands, feet, or limbs, and then spreads to other parts of your body. As the disease advances and nerve cells are destroyed, your muscles get weaker. This eventually affects chewing, swallowing, speaking, and breathing. Established risk factors for ALS include heredity, age, sex, genetics, smoking, environmental toxin exposure, and military service. Now moving on to Alzheimer's disease.
Now we'll talk about Alzheimer's disease. Starting with the definition, Alzheimer's is a type of progressive neurologic disease of dementia that has a negative impact on memory, thinking, and behavior. Biologically, the cause of Alzheimer's would be that brain proteins don't function normally, disrupting the work of neurons and triggering a series of toxic events. When the neurons are damaged, they lose connections to each other and eventually die. However, researchers don't know exactly what causes this. It could be due to a series of genetic, lifestyle, and environmental factors. For example, higher age puts you at risk, as well as head injury and family history of Alzheimer's. Some symptoms of Alzheimer's include getting lost in familiar places, forgetting the names of family members, decline in judgment making, struggle with everyday tasks, mood swings, wandering, and much more. Symptoms of Alzheimer's fall under the categories of memory, thinking and reasoning, decision-making, familiar tasks, and personality or behavior changes. Treatment for Alzheimer's includes 2 types of drugs, cholinesterase inhibitors and memantine. These are used to treat cognitive symptoms. It is also important to create a safe and supportive environment for those with Alzheimer's, for example, by keeping valuables in the same place or installing alarm systems. Alternative medicine treatments of Alzheimer's includes vitamin E, omega-3 fatty acids, melatonin, ginkgo, and curcumin. Home remedies, on the other hand, would be exercise, nutrition, or social engagement. While these treatments don't necessarily get rid of these diseases, they do help with symptoms. Now for a few quick facts. In 2021, Alzheimer's and other forms of dementia will cost the nation $355 billion. Also, Alzheimer's kills more people than breast and prostate cancer combined. Next, we'll talk about Parkinson's disease.
Parkinson's disease is a long-term disorder that affects neurons in the brain, decreasing the dopamine levels and damaging the motor system of the body. Factors that can cause this disease are genetic factors and environmental factors. Someone that has a specific genetic mutation that codes for this disease can have it. Also, people who are exposed to toxins or other environmental factors can get the disease, but there's a relatively small risk. Some symptoms of the disease are tremors, where a part of the body like hands or fingers start shaking, slowed movements, where the person has decreased abilities to perform movements that become time-consuming for them, or speech changes, where the person slurs while talking and has a monotone voice. Risk factors for this disease include age, heredity, and exposure to toxins. The older someone gets, the more they are at risk, and usually people who are 60 years or older have an even higher risk. People with a family history of having the disease, where the relatives were diagnosed with it, are at a higher risk of having it as well. Lastly, people exposed to herbicides and pesticides for long periods of time are at risk of having the disease. Unfortunately, this disease is incurable at the moment, but scientists are trying to figure out solutions for this. As of now, doctors recommend taking medication that they prescribe, which will help control the symptoms and alleviate the pain. Also, surgical procedures are an option, such as DBS, which stands for Deep Brain Stimulation. In this procedure, surgeons implant electrodes, which are electrical conductors, into the brain that are connected to a generator implanted in the chest and send electrical pulses to the brain, possibly reducing the symptoms. Overall, Parkinson's disease is dangerous, which is why it's important to take care of yourself and have a healthy lifestyle to decrease the chances of getting it.
Okay, so now we're going to move on to some common neurosurgical procedures.
Has anyone here ever had a family member have an anterior cervical discectomy or any form of spinal surgery before? Write it in the chat. If you don't want to say publicly, you can always privately message Viva. Okay. Before we get into what an anterior cervical discectomy is, let's go over why someone might need one. An anterior cervical discectomy is used to fix a problem with spinal discs by removing a degenerated or herniated disc. More specifically, if someone has worn down or injured spinal discs, or bone spurs in their vertebrae that are pinching their nerves, or have a herniated disc, those are all reasons someone may opt to have an anterior cervical discectomy. Next, what is an anterior cervical discectomy? It is a procedure that begins with a small incision in the throat after anesthesia and removes damaged discs. During this procedure, there is often a fusion of two or more bones together for stability, and the disc that is taken out is most often replaced artificially using something like a bone graft. This replacement disc is then attached to the bone during the procedure. In the middle top, you can see a diagram of what happens during the surgery. Now let's move on to what should be expected before and after this procedure. First, you should schedule the surgery and receive instructions from your doctor, such as to avoid smoking before surgery. The surgery also takes place under anesthesia, meaning that the patient will be asleep during the procedure. The surgery is usually an outpatient procedure, meaning that the patient will go home after the surgery instead of staying in the hospital overnight, unless there are complications, which we will talk about later. After the surgery, there is patient-specific advice provided by their doctor. However, the general advice is as follows. They would be given medications to manage their pain during recovery and will have to avoid strenuous exercises or activities. Eventually, they will later go to physical therapy to help regain their strength and mobility, especially in their spine. Then, 4 to 6 weeks later, there will be a follow-up doctor's appointment to make sure that the patient is healing properly. Finally, what are some complications and results from the surgery? There is a 73 to 100% success rate with pain relief from this procedure, depending on the location of what was in substantial pain, which is very high for spinal surgery. There is a possibility of anesthesia complications, as there are for any procedure that requires anesthesia, but that's pretty rare. Even rarer complications include long-term pain near the bone graft or replacement disc, an infection, excessive bleeding, especially if the patient is on blood thinners or has a condition that causes poor clotting. Now we will move on to Chiari Decompression.
The cerebellum is a small portion of your brain that coordinates various muscular movements, such as speech, posture, and balance. It is located on the lower end of your skull right above the brainstem. Chiari malformation occurs when brain tissue protrudes into the spinal canal. This adds pressure to your brainstem and can block the flow of cerebrospinal fluid. When the flow of cerebrospinal fluid is disrupted, it can accumulate in the brain and spine, affecting its ability to function. Chiari decompression is a surgical procedure most commonly used to treat this. At the beginning of surgery, anesthesia is given and the scalp is pecked. Then a 3-inch long incision is made in the occipital bone from the back of the head, and part of the C1 vertebrae is removed to create more space for the brainstem and tonsils, and this is shown in the picture on the right. The dura, which is the protective covering of the brain and spinal cord, is then opened to view the tonsils. After the tonsils are reduced, a dura patch, which is a synthetic material, is sewed on to enlarge the space around the tonsils. Lastly, the dura sealant is placed to reduce CSF leakage. After surgery, the patient is monitored for a couple of days and then discharged. For the next 2 weeks after surgery, it is important to avoid strenuous activities that can increase pressure to the head. Even though 85 to 95% of the patients experience major relief symptoms, it is important to remember all surgeries have risks. Some risks for this surgery include cerebrospinal fluid leakage, the collection of CSF under the neck tissue, nerve damage, blood clots, and more. Now let's move on to laminectomy.
Pain in the spine can restrict your ability to move and function. A laminectomy may be done to ease pressure on the spinal nerves, treat a disc problem, or remove a tumor from the spine. Generally, a laminectomy follows this process. An IV line may be started in your arm or hand, and if the surgical site is covered with hair, then the hair will be clipped off. And since you'll be under general anesthesia, the anesthesiologist will continually watch your heart rate, blood pressure, breathing, and blood oxygen level during the surgery. Then, the surgeon will make a cut or an incision over the selected vertebra. The surgeon then removes the bony arc of the posterior part of the vertebra, which is the lamina, to ease the pressure on the nerves in the area. And this may be involving bone spurs or growths, or removing all or just a little part of the disc. And then the incision will be closed with stitches or surgical staples. Then a sterile bandage or dressing will be applied to avoid infection. After, you will be taken to the recovery room for observation. And once your blood pressure, pulse, and breathing are stable and you are alert, you'll be taken to your hospital room. And a laminectomy usually only requires that you stay in the hospital for 1 or more days. And the risk of the surgery is bleeding internally, infection from the incision site, blood clots in the legs or lungs, spinal cord or nerve root injury, and risks linked to the use of general anesthesia during surgery. Next, we'll move on into understanding the common equipment and exams.
So first up is surgical tools. So along with using highly specialized technology, such as operating microscopes to carry out minimally invasive surgeries, neurosurgeons also use a variety of instruments and surgical tools. These are designed to assist in the diagnosis, treatment, rehabilitation, and prevention of a wide variety of disorders. Neurosurgical equipment is designed to be durable, lightweight, well-balanced, and needs to be easily controlled and manipulated in very small areas. Equipment can include the following: curettes, which are used for precise and delicate microsurgery. They're often used for the treatment of benign or low-grade malignant brain tumors. There's also hooks and probes, which are used to manipulate tissues and nerves and to explore areas around the spine. Rongeurs, which are used to create a window within the bone, such as a skull. Forceps, which are used to expose areas for surgery and to grasp, withdraw, or stabilize the tissue. Scissors, of course, for dissecting, cutting, and undermining delicate soft tissues. Dissectors, which are used differently from scissors, are used to separate, lift, or cut tissues during minimally invasive procedures and dissectomies. Retractors, which are used to hold an incision open or to hold tissue out of the way during surgery. Think of them like clips, and this allows for better visualization while the surgeon works. And finally, there's elevators, which are used to lift off bone or separate tissue, such as muscle from bone. Next, we'll be going over some common neurological tests, exams and scans that neurologists use to diagnose. So neurologists perform a range of different tests and procedures to diagnose and treat neurological conditions. Some of these procedures can include the lumbar puncture, in which neurologists insert a hollow needle into the space surrounding the spinal column in the lower back to withdraw some cerebrospinal fluid. This helps to diagnose meningitis, encephalitis, myelitis, leukemia, autoimmune diseases like multiple sclerosis, dementia, and bleeding in the brain. The procedure can also be used to inject medicine. There's also electromyography, or EMG, which is used to assess how well a person's muscles respond to electrical stimulation from motor neurons, which are specialized nerves that control muscle movement. So how is that done? Well, a trained technician inserts electrodes, which are small needles, into the muscle, and then those electrodes record the different electrical activity that occurs in muscle tissue during periods of movement and during periods of rest. And then the EMG machine produces a record of that electrical activity, which is called an electromyogram. The results of an EMG are used to diagnose neuromuscular diseases such as myasthenia gravis and ALS. There are more neurological tests on the next slide. So the third one is the Electro Encephalograms, EEGs, which are different from EMGs. And these are used to measure and record electrical activity in the brain instead of just the muscle. And then basically neurons in the brain communicate with other neurons through electrical impulses, which an EEG can pick up. An EEG can also track brainwave patterns. During an EEG, a technician will place electrodes on the person's head and they connect to a computer that converts electrical signals into patterns that the technician can view on a screen or print on a piece of paper. And then those results are used to identify abnormal electrical activity in the brain and diagnose certain conditions such as epilepsy, seizures, brain tumors, and sleeping problems. Lastly, there's the Tensile test. So myasthenia gravis, which is a rare neuromuscular disease that weakens the muscles in the arms and legs, can be diagnosed with a blood test called a Tensile test. The reason why it's called a Tensile test, not just a regular blood test, is because Tensile is the brand name of a drug called idrophonium, which prevents the breakdown of acetylcholine, which is a neurotransmitter that stimulates muscle movement. Myasthenia gravis causes the immune system to attack acetylcholine receptors in the muscle, causing muscle fatigue and decreased muscle movement. So during a Tensile test, a neurologist will inject a small amount of Tensile into the bloodstream, and then they'll ask the person to perform different movements, like standing up and sitting down, holding their arms above their head, crossing and uncrossing their legs. And then the neurologist will continue to administer a dose of Tensile each time the person feels tired. And then if the person notices that their strength returns after each Tensile injection, that indicates that they're likely to have myasthenia gravis. And lastly, for some general neurological tests, these are tests that can be used to help diagnose general neurological disorders and not really specialized. So they'll do laboratory tests such as blood and urine analyses. They'll also do imaging tests like ultrasounds and MRI, CT, and PET scans. They'll also do genetic testing, biopsy, and angiography. And that marks the end of the presentation. Are there any questions?
Yeah, if you have any questions, you can feel free to put it in the chat. But I think we've dropped many clues here with a shorter presentation and a big K in the top left corner of the screen. As you can guess, we're going to be doing a Kahoot. Oh no. Wait. Oops. Pretend you didn't see that. Okay. So get ready to type in the join code. And then we'll be playing a short Kahoot to review the questions. If you have any questions, you can also feel free to type them in the chat and we'll answer them while we're waiting for people to join. Okay, so join code. Yeah, Rowan put in the chat, you go to kahoot.it and then you type in 6746472. And then we have Gamerfish, like we do every time we play Kahoot. So again, the join code is 6746472. And we'll try to get started in the next minute or two. Okay, in the interest of time, just so that we can get through all the questions, I'll start the Kahoot, but the code is always in the bottom corner, so you can feel free to join that way. Okay. So the first question is, what is the difference between neurologists and neurosurgeons? And the correct answer is that neurologists can't perform surgery, while neurosurgeons can. Okay, second question is, what are headaches caused by? Changes in eating or sleeping patterns, stress, consuming too much food, or all of the above? Okay, so consuming too much food won't cause headaches. It might cause a stomach ache, but headaches are mostly caused by changes in eating and sleeping patterns and also stress. Okay, which is not a symptom of ALS? Yeah, so the correct answer is fatigue and drowsiness. A lot of people chose inappropriate crying, laughing, or yawning, but that is a symptom of ALS. And then next we have, which is not a symptom of epilepsy and seizures. There's staring, intense feeling of fear or joy, temporary confusion, and also long-term sadness. Yes, the correct answer is long-term sadness. Staring into space is a symptom of epilepsy and seizures. Okay, next we have a true or false question. A stroke happens when blood supply to your brain is too high. Okay, this is false. It's the opposite. When the blood supply to your brain is too low, that's when a stroke happens. Okay, we have another true or false about different type of strokes. So like just identifying what they are and whether they're true or not. Okay, so this is false. It's actually the other way around. So a hemorrhagic stroke is when a blood vessel ruptures, and an ischemic stroke is when a clot blocks the blood from flowing. Good job, Marin. Okay, we have another true or false question. There are two main types of epilepsy seizures, general and focal. Okay, so a lot of you answered this really quickly. It is true.
That's my oatmeal. Yeah.
Okay, next question. Where is the incision usually made during this discectomy? Sorry. Okay. The correct answer is in the neck. It's not the spine, throat, or cervix. Okay, and then next question, what is not a symptom of Alzheimer's? Okay, yeah, shivers is the correct answer. Okay, and then which is not a risk factor of Parkinson's disease? You have none of the below: old age, heredity, or exposure to toxins. Yeah, most people got it right. None of these are not a risk factor of Parkinson's. And then this one is correct. All of the answers here are correct. This is general and focal are the two types of epilepsy and seizures, which you went over a little bit earlier in the question. Okay, these next ones are kind of they're like fun questions, so we'll just skip those and then go to the leaderboard. Hold on, wait, I will show the leaderboard in the recap email, but we have a little bit less than a minute left. So this is our social media information. And then our next session is not next week because of Indigenous Peoples Day, but it'll be October 17th, and we'll be talking about learning and environmental effects and neuroplasticity also. So kind of like related to the brain. So kind of like continuing off of today's presentation. Yeah, so we have less than a minute left. I'll send out the leaderboard in the recap email, but thank you for coming. Oh, and have a good weekend.